Looks like it's on.
There it goes. Okay.
Well, hello and good afternoon, everyone. I feel like it's been so long since we've gotten to talk to you as a group. As of last February, so this is February of 23, it's been 1 year since we've moved on to other things, and you were transitioned over to the state. So super excited to have you here today. And I know that there are a lot of new faces, and I hope that some of you who are new are on the call today. And we hope that this information today will prove useful to you. My name is Stacy Farman, by the way. For those of you who don't know me, I am a nurse and I'm the lead epi for the long-term care team. And also Katie Pania is going to be on the call today. And she is also on the long-term care team. Oops. Let's see here. There we go. So how is everyone feeling about the future of COVID? Are you sad? Are you happy? Are you hopeful? Are you nervous? Katie's going to put a poll in the on the screen, and just to get a feeling for how everyone's feeling about COVID today. Katie, go ahead.
Can everyone see that? It should be in the chat as well as on the screen. Can everybody see that?
Please unmute yourself if you and just
I
let
got
us
a
know.
thumbs up and I see a couple of responses coming in, so I think we are good.
Awesome.
I'm gonna give it couple seconds here. We'll see what we get as responses, and then we'll do a little brief summary for what the group consensus is for how we're feeling for the future of COVID.
I don't see a poll. I just see the slide that has the faces.
Uh-oh.
Are you on your phone?
No, I'm on my computer.
That is weird.
Can we just put it in the chat then?
Yeah, if you want to just go ahead and put your answer in the chat if you're comfortable. Sad, happy, hopeful, nervous. Okay, so it seems a majority are hopeful, which is great. We have so out of the kind of the percentages here in the poll, nobody is happy or sad. So far, most hopeful is the majority, and then about 1/3 reporting to still feel nervous. And then in the chat, kind of a mixture of those as well. Thanks for participating in that. We just thought it would be good to kind of get a group census of how everyone is feeling at this point.
Exactly. Thank you, Katie. So let's move on. Today we're going to talk about a couple of things. Public health emergency is ending. We just thought we would cover a little bit of that. We're going to go over some of the data for Boulder County. We're going to talk about wastewater surveillance, when to call us. All of our contact information has been updated, so we're going to provide that as well. And then how to fix blocked secure emails, because that still seems to be an issue. And then any kind of future information sessions that you might be interested in. And I can't see the chat. So if you have questions or concerns or just whatever, go ahead and put those in the chat and my team will let me know. So what happens when the public health emergency ends, and that's in May? As far as vaccines go, the FDA and FEMA emergency is not ending, so vaccines will continue to be available. The US government will cover the vaccines until their stockpile is used up. And then private and public health insurance will cover the vaccine once the stockpile is gone. National surveillance, the National Wastewater Program will continue for now. And positivity rates will likely go away since the CDC cannot compel labs to report. Hospitalizations, the CDC will still collect that data, but the frequency will change. And then therapeutics, Paxlovid is still available. There's a large stockpile, and it should last through all of this year and maybe into next year. That's not going. There we go. So healthcare coverage, Medicaid continuous coverage will end April 1st. So between 5 and 14 million adults and children will lose their Medicaid coverage. The 20% increase in Medicare reimbursements to hospitals will end as well. And then there are a variety of different waived regulations pertaining to SNFs that will end also on May 11th, which I'm sure that you guys are more than aware. As far as like national, state versus local, the states will be responsible for transitioning from Medicaid continuous coverage back to monthly checks. And I put in here a link. So if you have anyone who needs to make sure that their contact information is updated so that they can make sure that they get renewal packages if you wanted to share that with your staff today. And then wastewater surveillance at the local level will really depend on local budgets. So I wanted to kind of talk about, the difference between community transmission and community levels, because I still think there's some confusion about that. And when you go on the website, I think it's pretty confusing as well from the CDC. So community transition levels, those are levels that are used by the healthcare and SNFs and some memory cares. So incidence rate represents the rate of new cases of a disease or condition observed with a given period. So we most often, when we look at this, we see new confirmed COVID cases per 100,000 people in the past 7 days. Positivity rate is the number of positive confirmed tests over all tests for the illness in a given period. So again, we kind of see this when we see COVID data as the number of confirmed positive COVID tests over all combined tests over 7 days. Let's see here. And then community levels, which is used by the public, assisted livings, and some memory cares. Again, same incident rate, new confirmed COVID cases over 100,000 people in the past 7 days. But there are 2 other indicators that we use, and that's new COVID hospital admissions per 100,000 over 7 days total, and the number or percentage of staffed inpatient beds used by COVID-19 patients in 7-day total. So I just want to recognize that all of this data and the next following slides come from Steffi Goodman, and she is our data expert extraordinaire, and I really appreciate all the work that she does to provide this to all of us. So again, community levels, that's what we use for the public, for assisted livings, for independent livings, and some memory cares. Our incidence rate as of last week was 53.04. And then as far as those 2 new indicators that we talked about, new hospital admissions per 100,000 was 9.3, so anything less than 10. And the percent of staffed inpatient beds occupied by COVID-19 patients is 1.9%, which is anything less than 10%. And then as far as community transmission in Colorado, currently we are in high, and that community transmission is what we use for healthcare systems and for SNFs. So as far as takeaways, as testing numbers decrease, so those would be those PCRs and proctored antigen tests, and home testing and no testing increases, underreported case numbers no longer have meaning in determining community levels. So we really use those two other indicators to speak to community levels. So the new hospital admissions per 100,000, and then the percent of staffed inpatient beds occupied by COVID patients. And community transmission is calculated using confirmed COVID tests, so not rapid antigen testing. And positivity rate uses confirmed COVID tests, which we know that are both artificially inflated, since most testing of symptomatic cases are receiving medical care. This means that community transmission levels have less meaning than they did when PCR testing was done on a large scale. So we know that the public testing sites, those free testing sites, ended in January. So most testing is done at home, or no testing is done, or testing is done in the hospital setting. So if these indicators are less reliable, what does paint a more realistic picture? So are low community levels truly low? First of all, what is wastewater surveillance and how does it work? So basically, a COVID positive case sheds virus, and that virus enters the sewer system. A sample is taken before it goes into the treatment center. And those samples are submitted to a lab where they measure viral load. And then those are reported as increased, decreased, or plateau levels. So looking at the graphs, on the left is the city of Boulder. And you can see that the blue line represents confirmed cases that have been reported. And the brown line represents wastewater surveillance. And as you look at the graph during the Omicron stage or surge, we really see that the wastewater surveillance and the cases reported really mirrored each other. But as at-home testing became more popular, or no testing has been conducted for positive cases, or what we think are positive cases, it really has broken away from wastewater surveillance, and there is that large discrepancy. The graph on the right is for the city of Longmont. And again, the orange represents wastewater surveillance, and the blue representing cases that have been reported. So this graph is basically taken from the website for CDPHE wastewater trends. And as Erie, unfortunately, is experiencing steady increase. Boulder, Lafayette, and Louisville are experiencing increases. In Boulder, Longmont is in a plateau. And all of these numbers don't add up for Boulder, but these are actually numbers for the entire state. So we're not the only county that does wastewater surveillance. Oops. There we go. So we know that wastewater is becoming more and more important in measuring true levels of COVID in the population. But how do we use all this information, right? So the biggest thing is for now, until different metrics change, we need to follow CDPHE and CDC guidance. We all feel that probably wastewater surveillance will become more important as a metric from the CDC. So we need to also find new ways to educate on COVID mitigation for residents, staff, and for families. Vaccinate. If you have residents who have yet to be vaccinated, vaccinate them, get them boosted, and use therapeutics. And then I put a link here in the slides to check on the wastewater surveillance from the state weekly. And this will help inform you of the current level of COVID activity and how this might change your level of protection. So if we're in, community transmission, um, is masking warranted? Do we increase our airflow in our building? Do we have a second thoughts about doing outings or certain types of outings for those who are at very high risk for illness? So I'm going to pause there and see if anybody has any questions.
Stacy, this is Michelle. I'm just
Uh-huh.
curious to know if you think, or I'm curious to know your thoughts on whether CDPHE will elect to move to wastewater versus community transmission levels for SNFs, just because it does provide better data than what's currently out there. Specifically, I think hospitalizations are down.
Yeah.
But is that it's not really truly tracking the incidence of COVID in the community.
Right. I can't speak for this, for CDPHE as to what they'll do, but and Steffi's on the call, and I'll let her chime in as well if you don't mind, Steffi. But we do really see the value in wastewater surveillance, and I think the state does as well. And I think there are certain metrics that are going to go away with the CDC as far as like positivity rate. Um, so I think that with all those things, they'll be looking for new ways to measure risk. But I would love to hear what Steffi is thinking about that as well. Is she on? I could have sworn I saw her on, but I'm putting her on the spot. So if she's not on anymore. But so yes, I don't have a crystal ball, Michelle, but I think that I wouldn't be surprised if they move in this direction. Wastewater surveillance. Oh, go ahead.
Oh no, I was just gonna say this is Katie. Steffi, I think she's trying to talk. I don't know if maybe something is up with her mic. Steffi, do you want to try again?
Can you hear me?
You're very quiet. Try again, Steffi.
Can you not hear me at all?
Oh, now we can hear you.
Oh, that's so weird. Anyway, thank you for your question, Michelle, and this is Steffi. I agree with Stacy. I think you have a perfect question. And I think lots of people are asking that very same question, like where do we go from here in terms of monitoring and measuring and making decisions based on what we find. But I think my impression anyway, is that everybody waits for CDC to make changes before they go ahead and change how they're going to monitor, what data they're going to use to monitor and make decisions. So I think I've heard like mumblings, grumblings about CDC making some changes, but it's, I think we just have to wait and see if that makes any sense.
Yeah, it makes perfect sense. Thank you.
Mm-hmm. And what I was going to say, just, again, funding for wastewater surveillance is, I think, is probably steady as far as like the CDC doing wastewater surveillance, because they use that surveillance not just to measure things like COVID, but things like polio in areas that have really low polio vaccination rates. They can use that viral levels from any viral illness to measure what's going on in community. So it won't just be dependent on COVID. They're using it for other things. As far as wastewater surveillance at a local or state level will really depend on funding. But for now, we will continue to do wastewater surveillance. So, any other questions? Okay. Well, if you think of something, go ahead and just put it in the chat. So, Katie, you are up.
All right. Thank you, Stacy. So transitioning kind of away from COVID, we wanted to put out there common when to call us. I don't know where I read common, when to call us. Situations that might arise in your facility when we would like you to reach out to us for support. So when you have any sort of new outbreak or cases of non-COVID illnesses in the facility, this can even be prior to confirmatory testing, especially if there's suspicion it's not COVID, if it's much more respiratory-like, GI-related. When you kind of are starting to see an uptick in symptoms, again, before confirmatory tests, any of those situations, we would like you to reach out to us. If you are in an active COVID outbreak and you're already working with an individual from the state, say that you then had an individual test positive for RSV, and then a couple of others test positive, then they would work with you on the secondary outbreak. Likely, there have been times where they have passed off the secondary illness outbreak to us at local public health, but I would say a majority of the time, if you're already working with someone with the state, they'll kind of take the secondary outbreak as well. If you're not in a COVID outbreak, then we would be your point of contact, and you can call one of us with Boulder County Public Health, and Stacy or I or Rebecca. I'll show, we have another slide next with kind of who's on the team, who is still here, and who's transitioned off of our team. But we will help submit REDCap forms and go over any other paperwork that is necessary to submit to the state. And then we kind of work as your liaison to report to the state. They're especially looking for hospitalizations for a majority of these kind of non-COVID illnesses. But we kind of help provide those updates weekly to them so that you don't have to. And then we help provide infection prevention to kind of help keep the spread of disease low within your facility. And so in this slide here, those are some of the more common REDCap form outbreak report forms. There's the one for non-COVID respiratory, and then for GI, and then below there are just some of the more common types of illnesses that we see in long-term care and the definition that would meet outbreak. So norovirus, undiagnosed GI, especially if you have residents or staff that have symptoms that the duration's really short and you're not able to test them, that's pretty common. And so that still, though, meets the definition of a GI illness outbreak. So those definitions are there. So in all of those circumstances, we would love for you to reach out to us and we'll help kind of provide that support. And then beyond disease, the other kind of area that we provide support for you all is with anything emergency preparedness related, questions, concerns, review of plans, emergency plans, anything like that. We're happy to help at any point. So please reach out to us should you have questions or concern with any of these items, and we're happy to help. Okay, so as promised, here is kind of the contact information update. So who is still here? Stacy, myself. We also have Rebecca Herman, Debbie Martinez, and Sarah DeLong, who are also part of the Congregate Living Long-Term Care team. Marilee and Rohini, if you ever worked with either of those two fantastic individuals, have transitioned off the long-term care team. Rohini is getting her doctorate, and Marilee is still with Boulder County, but she has transitioned off of our team and is working with another priority settings team. And then those are all of our email addresses there. We do have one kind of universal team email address and phone number, and that's the epi@bouldercounty.org, and there's the phone number there. For weekends and after hours, we put this in our signature, usually our out of office, or within our signature if it's just for after hours. We ask that you either email that email address or call that phone number. It's the communicable disease hotline, which is there and monitored 24/7. So there will always be someone on the phone answering you or will return your call quickly. And really this is for, urgent questions or concerns, or if you have an immediately reportable condition kind of outside of our hours of operation, you would use that email or that phone number. Otherwise, you can feel free to reach out to any of us that are presented in this during normal business hours. And I can make sure that I include our phone numbers too. We will send out this slide deck after the call. I'll make sure I include our phone numbers as well. And then one other thing I wanted to notice is the inactive team addresses and phone numbers. The long-term care COVID-19 at bouldercounty.org and the COVID-19 epi line have since been inactivated, so they will no longer come through to anybody with Boulder County. So if you do have those in your contact list, or if you have Marilee or Rohini, we do ask that you remove those so that we can make sure that we're responding to you and you're getting a hold of us as quickly as you can. And then the last thing on here that I wanted to mention or bring up is since it's been a year since we've spoke to a lot of you, we were hoping to kind of update our contact list on our end. So if any of you have any new staff that have been hired on or have transitioned off and you've replaced their role, we would love to have their contact information. And you can either email that to us, or if you're comfortable putting it in the chat here. That is super important for us to have kind of the most up-to-date contact list. And this can be especially important should there be a situation that arises and we need to get a hold of you. So we love to request not only contacts that are there during the week, Monday through Friday. We know that issues can arise after hours on the weekends. So kind of providing multiple contacts, phone numbers, emails for kind of all hours of the day, 7 days a week, so that we could get a hold of, any of you at the facilities is great. So if you are comfortable sharing that in the chat or emailing that over, if kind of in the last year you've had any new staff on board, we would love to have their contact info, and as well share our info with them as well. All right, so blocked emails. So with Boulder County Public Health, we've identified a problem with firewalls restricting your ability to see our secure documents. So Boulder County Public Health encrypts emails with a encryption system called Zix, Z-I-X. And so oftentimes if you do receive our emails, they'll come through as it'll say something in the headline as secure email, and then kind of go on to say whatever else we put as the title of the email. But there are several instances where we've had that those secure emails are being blocked by your firewall prior to even receiving them. And part of the issue is that we don't have a way to verify if they're coming through. We don't kind of get a bounce back right away that says you didn't get the email. It just looks on our end like we sent it and we never got a response back. And so I kind of looked into this, worked with our IT department, and they provided this link here, the learn.zix.com, and that is a way you can test your firewall restrictions at your facility. And if you do see that you're not able to view emails through that, you can either email this or kind of have your IT email this IT at Boulder County, or you could email one of us and we could work to get in touch with our IT and your IT to kind of figure out how we can get those pushed through and where the point of failure might be. We are also happy to send test emails. I know a couple of you that I've worked with recently, I kind of sent a test. Can you see my encrypted email? Just another way for us to get in contact with you, especially we will encrypt them with any personal health information attached or anything that's in there that needs to be protected. We'll send those through that encrypted site. So we just wanted to give you that link, and then please feel free to reach out if you do know that in the past you've had issues with our secure emails, or if you've kind of looked into it and it looks like they might be blocked. And we are happy to work with our IT and get that figured out so that we can kind of contact you at any point and make sure that those secure emails go through on both ends. Okay, so I am going to launch another poll. We are looking at future topics for these information calls. So I have a list of, I think, 6 different topics that we brainstormed we thought might be of interest to you all. So I'll put them up. It'll be multiple choice, and you can click which, one of them, all of them, none of them, if they're of no interest to you. And then I also would welcome you all to put additional topics in the chat should you have other areas that you would love us to talk about. That is my corgi dog, if you can hear her barking. Okay, so I just launched the poll, should be on the screen as well as in the chat, but the topics that we kind of brainstormed are MDROs, which are multi-drug resistant organisms, and we can prioritize that or make it more specific to long-term care settings, respiratory infections, emerging threats and infectious disease, zoonotic diseases, or zoonoses is also what they're known as, which are infectious diseases that kind of jump from non-human to human, or it can be vice versa. Transmission-based precautions overview, cleaning and disinfecting. We kind of thought we could come up with a way to make this new again in your facility, as we know with COVID and kind of everything else within the last couple of years. Not hard to have burnout with a lot of these topics. So we thought maybe we could come up with a way to make it new again in your facility. And then respirator fit testing is another item that we kind of had in there. So do you see that on the screen? I'm not seeing any answers come in yet.
I don't know if you can hear me. I only saw, how are you feeling? Nervous, happy, sad, or something else. I didn't see any other poll.
Okay, maybe I need to end the first one to open up the second one. Let's see here. Thank you for that feedback. Let's see here. Let me close this one and reopen it maybe. Okay. Let's see, now can you see the second one? There we go. I can see your responses now, actually.
And we really wanted to target these to more educational sessions that you may not get from the state. A little bit different focus, a little more infectious disease type of information sessions that might affect your long-term cares, like West Nile, different respiratory infections, enteroviruses, RSV specific stuff, just those types of things that we thought that could be useful or interesting, whether it be for your, for your staff, for administration, or for your infectious, or for infection prevention staff in particular. So.
Yes, thank you, Stacy. And it might be something too, that we hold a call, and if we might be able to provide like a one-pager summary that you could post in your facility, or kind of give back to your staff to summarize what we go over. Whatever you think would be most helpful and informative is what our goal is. It's not meant to be boring, or we want to respect your time, certainly. So kind of whatever the group consensus is how we'll move forward. And I'm seeing we have quite a bit of you interested in MDROs, respiratory infection, emerging threats, transmission-based precautions, and cleaning and disinfecting. So thank you all for that feedback. If there are any other ideas, we welcome them. Please put them in the chat and we'll make note of that. And we will target those for our future topics as we move forward in the coming months.
And we're envisioning maybe once a month, and anywhere from 30 minutes to an hour, depending on the topic. So, because we want to be respectful of your time as well.
And then Stacy, before we move on, I see a question. Oh, I guess this moves perfectly with our next slide of questions. Ashley said, will the end of the public health emergency bring about any ending or any changes to mask mandates?
So the question, or the answer to that is no. For long-term cares, it will not change anything. As you are probably aware, the Public Health Order 2020 expired. That was the public health order that covered long-term care facilities and other group homes, that type of thing. But that was incorporated into emergency rulings that were adopted by the State Board of Health. Those are emergency rulings, which means that they will expire in April, but they anticipate having a hearing to make those permanent before that expiration date. So all of the things that long-term care facilities do to meet that public health order, such as masking, PPE use, testing, outbreak management, things like that, will all stay the same for now, and won't have any changes related to the public health emergency. Ending, I mean. I hope that made sense. Any other questions right now? And if you think of anything else that might come up, please feel free to email us, and we're happy to get back to you. So we had planned on maybe doing this like every 4 weeks. So that would be March. Help me out.
27th, Monday, March
27th.
27th.
Yep.
Yep.
And it would be again for depending on the topic, 30 minutes to an hour over lunch time, again to respect your time as well. So if there are no other comments or questions, we appreciate your time today and allowing us to come into your lunch hour and just talk about wastewater management and surveillance and what that looks like. And we are excited to see you again in about a month. All right. You guys have an awesome lunch hour, and thank you for attending, and we'll see you again.
Thank you.